I'm Andrew Oberholzer, CEO of the Prostate Cancer Foundation. Today, my special guest is Prof Shingai Mutambirwa, Head of Urology at the Sefako Makgato University of Health Sciences, and also the Chairman of the Medical and Scientific Advisory Board for the Prostate Cancer Foundation. Thanks for coming through to talk to us today, Prof.
Thanks for the invitation, Andrew.
Prof, there's a lot of talk about PSA testing and screening for prostate cancer. What tests should men undergo to check whether they have prostate cancer? Because as I understand it, there's no symptoms in the early stages of prostate cancer.
You're completely right, Andrew. I think the important thing for men to recognize is that the commonest cancer that men get after skin cancer is prostate cancer. And it's also the second leading killer of men when it comes to cancers after lung cancer. The problem is that the prostate is a little gland which sits just below the bladder. It's in a very isolated position. And most of the cancers occur on the outside part of it. And although it is surrounding the pipe for passing urine, which we call urethra, the issue is that it's only when the prostate cancers are very large that you'll actually get symptoms like difficulty passing urine and that sort of thing. And what we're really trying to prevent as the Prostate Cancer Foundation and globally is to prevent men getting what we call metastases, which means the cancer has spread away from the gland and is now not curable. And the commonest places that the prostate cancer spreads to is to the back, to bones, which can give severe bone problems, paraplegia, and that sort of thing. So I think the trick for most guys is to understand that from the age of about 40, particularly in white men, and probably from about 35 in black men, because black men are more likely to develop prostate cancer for various genetic reasons and things like that, that you should be going to your physician about once a year or once every second year to get a nice little physical, which will also include your sugar, blood pressure, and that sort of thing. Make sure that you do get an examination from your doctor. And the important thing is to remember that the blood test, which we usually do to pick up if there's a possibility of cancer, it doesn't always mean cancer, but the possibility is this PSA, which stands for prostate-specific antigen. It's a simple blood draw. It doesn't matter what time of day it happens. And it gives us a very good indication if there's a possibility of cancer. At the same time, we often will have to do what's called a DRE, or digital rectal examination, which is basically we put our finger in the anus to feel if the prostate has any lumps or bumps. It sounds nasty, but it's really not that nasty. It's a very quick procedure. It's a very well lubricated finger. And the good news for some guys who don't want to have a DRE is that there is some evidence now coming out that if we do a PSA at an early age, from 35 or to 40, depending on what race you are, we can stratify you and make a decision on whether we really need to do the DRE if the guy is really uncomfortable with the examination.